Hey guys, what's up? Medic Steve here. Went over my bag again with my buddy down in San Diego. Awesome dude. He's a SOCOM medic, and he gave me some of his personal tips and tricks on what he did with his M9 bag and how he utilized it when he was in the field. And pretty excited about that. There's a few things that I use now that he doesn't have experience with, and my other buddy Brian is actually teaching me with that, and I'm super excited to have these skills that a lot of modern guys aren't actually too keen on. So with that being said, I'm gonna move on. Before I even hit my march algorithm, I want to talk about how we get our patient off the X. You can either do whatever you got to do to get that patient off the X. Sometimes it's gonna be fast, sometimes you can do whatever you got to do, but this actually is pretty helpful, and I'm going to utilize this ERS strap as much as I can. 90% of the time though, in a TCCC scenario, and if you are in direct fire, you're gonna have to get out of there pretty quick. So do whatever you got to do, get off the X. Now getting into my march algorithm, I'm going to open up my bag. I'm going to go down the list, right? Boom. Even to help me, because I know shit gets fucking crazy under that stress, right? You got your freaking march algorithm ready to go. What are we gonna do after our march algorithm? We're gonna freaking call in a 9-line. So I always got this on the side now, ready to go. Help me out. Grease pen to write on anything that I need, and a regular pen. Okay, so if you're in a regular scenario where you don't know who you're dealing with, always have gloves ready to go. Like I said, shit gets really super fast. You need to know where you're at. Want to be the first thing you're gonna want to see. Bam, go ahead and grab those out. What's gonna happen? What do we got to deal with? Massive hemorrhage. Okay, we see something, we're gonna stop it. Boom, we got tourniquets up here. Bam, we got a ton of gauze. I even have a hemostat. Hey, if you're freaking Ricky Recon and you're good to go, and you can go ahead and you see that artery and you can clamp it, bam, go ahead and do that. But don't sit there and try to be freaking Captain Sableho and wasting all this time trying to do that, because I heard some pretty bad horror stories about that. So going down, we also have our ACE bandages, because we're still going down march and we're still fixing our massive hemorrhages. What's after hemorrhages? We're gonna go down the airway. Boom, NPAs, we got our chest seals and all that shit. We're gonna go to respiratory. We have our BVM, we got everything for that. We even have some glow sticks. What do we always forget to? Our TCCC cards. Boom. And then what do we forget to? Hypothermia. Bam. Emergency blanket. Saline lock IV kit. Let's see, before I get too ahead of myself, when we're going through our secondary assessment, checking stuff out, and we're 10 minutes out from our Casevac or our Medevac, either or, whatever's coming, 10 mics. You can start gathering your chest sounds, your abdominal sound. You can start doing your percussion, all that good stuff. Whatever you know has your secondary assessment, depending on how far you are in your medical, do what you can to make sure that everything's good. So when you're filling out this TCCC card and you do a transfer of care, you did your due diligence, yo. So going down here, we got needle decompression needle right here, and so I just got these today. These are McGill forceps. So you have to get inside. Boom, you can pull something out of somebody's airway if you need to. Bam. Also good for endotracheal intubation. I had these originally, so I might actually pull these out. These are large hemostats right here. I like them because I feel like you can get inside and, you know, boom, pop that shit. Open the airway, look inside, you see inside the mouth. Bam, you gotta pull something out. Go ahead and do it. Got some triangular bandages down here. And closing this up now. Now it is a little hard to close this up because of the fact that it is packed to the gills. But consider the fact that while I am treating a patient, less stuff is going to be utilized. Stuff's going to be utilized, and it's going to be less packed. So As you can see, it wasn't that hard to actually close it. Now, going down here, I got my ropes. If I have to make a setup where we have to do lower the patient or raise the patient to a certain area for treatment or for Kesevac, we can do that. In the back, big old red signifier. If I need to alert the helo or anybody that I am the medic that has the patients that need to be moved, I have a big red marker on my bag. We have this nice draw sheet, super thick, durable, that can move a patient in and out of a scenario. It has loops at the ends too for people to grab onto. And I have my rope. This rope is connected to a carabiner. It has 75 feet of rope. It is intertwined down my back of my bag, so I can actually connect this to an anchor, throw my bag down, do the rappel, set up a system for the lower to raise or whatever we got to do, and we are pretty much good to go. Like I said, I'm learning a lot from my buddies out there over in San Diego. They're teaching me a lot of stuff, and it's gonna help me be a better medic out here in LA. And that's exciting for me, exciting for the crew that I'm working with out here at my job, and exciting for everybody. I'm happy, everybody's happy, and that makes a good medic. So you gotta be safe out there. Medic Steve out.